Hi, Sal. I'm Rick.
Hey,
Hey
yes,
Rick, hey Kevin.
Kevin.
Calling
There we
Kevin Morgan, mobile.
Hey Joan.
Hi.
Hey,
Hey Day.
Hello. Hi. I think we're just waiting for Carrie. Sophie isn't able to join us tonight. Hi, Adi.
Hey, Ade, how's it going?
Welcome.
Thank you.
Ade.
Good evening.
hey, Addie. Nice to meet you.
Nice to meet you all.
Okay, we'll probably give Carrie one more minute and then we'll get started. Right. So why don't we go ahead and get started? Um, so let me just call the meeting to order and we'll do our usual roll call. If you just state your name. Sal,
Monty.
Kevin,
Kevin Sexton.
Joan,
Joan Wetzel.
Adi,
Ade Bengali.
and Rick Lopez. Before we get into it, we wanted to welcome our new member, Adi. Adi is on a work-related trip, and so he's only going to be able to be with us for the first 30 minutes for tonight. I thought what we might do is actually just kind of go around and introduce yourself, your name, maybe how long you've been on the board, and one sentence about kind of what you do on your day job. Um, so I'll start. I'm Rick Lopez. I'm the chair of the board, and I'm a retired physician. I was a primary care doctor, internist. I also had significant administrative responsibilities at Atrius Health and Harvard Vanguard where I practiced for about, I don't know, 35, 38 years. So we'll just kind of go around. Sal, you want to?
Sure. Sal Bramante. I've been on the board about a year now. I've been in the wholesale seafood industry for 40 years. I'm in charge of operations and quality assurance for $330 million company right now.
Hmm.
So that's what I charge of all inspections and regulatory aspects of the company. But it
Great, thank you. Kevin.
Hi, Kevin Sexton. So I have been on the board, I'm trying to remember now, since I want to say 2018, maybe. So yeah, so I've been on the board for a while now. I'm a realtor by trade, but I have a strong background in town government. I was on the Board of Selectmen here for one term. As well, I've been a long-time town meeting member. So I'm kind of on that side of the aisle, Addie, as far as the procedural issues go.
Wonderful.
Joan.
Hi, Addie. I'm just starting my second year on the board. I'm retired from lab work. I worked in a hospital for 12 years, and then I worked at a very large local pediatric practice in their lab for 27 years. And I'm joyfully retired now.
Awesome.
Liv.
Hi, Addie. Nice to meet you. I am the public health nurse for Reading, so I work under Aday and with the board. It's nice to meet you.
Fantastic. Nice to meet you too.
And Aday, I think you've already.
Right, so I'm going to introduce myself and then introduce the health department as well. So my name is Aday Solarin. I'm the public health director for the town of Reading since 2021. I've been in the field of public health for 17 years. The health department has a total number of, we have 7 employees, 4 full-time employees and 3 independent contractors. Our full-time employees include Amelia, who is the health inspector, Liv, who is the public health nurse, and Haley Murphy, who is the admin staff. Our independent contractors include Kevin Nichols, who is the animal control officer, John Ferreira, who is the weights and measures inspector, and Maureen Busby, who is the tobacco compliance inspector. It's good to be here, and we're looking forward to working with you.
Same. Should I
And
introduce myself or?
yes, please.
Of course. Thank you, by the way. I am excited and you guys look fantastic and everyone has a ridiculously awesome experience. So I'm very humbled to be here actually. My name is Adi Bengali. It's pronounced Adi. And I've been a Reading resident since 2017. I have a young family here as well. And just last year, I got elected as a town member. I actually wrote myself in and somehow that worked out. But just to see what happens behind the scenes and all the passionate discussions and everything really, really overwhelmed me in a positive way. And so that's when I decided I want to do more just outside my work life and find my real passion. And talking about work, I actually work in a very relevant field. I work in a company called Vaxcyte. So I'm actually in California right now, just visiting the head office. I'm fully remote in Boston or in Reading, and I'm a program manager for the company. And Vaxcyte is they're making pneumococcal vaccines, for infants and then all the way to older adults. So it'll be like Prevnar and Capvaxive. And so for me, you can tell it's a very close matter to my heart, just in terms of public health and whatnot. So excited to learn and just hear you guys, your experience and your wisdom. So thank you again for having me.
Great. Welcome. I'm sure you'll add a lot to the discussion. And I just want to acknowledge Haley, who's on our screen as well. Haley, do you want to?
Hi, nice to meet you.
Nice to meet you, Haley.
Okay, so in terms of tonight's agenda, we're going to review the minutes from our June meeting. We didn't have a July one. Public comment, although right now I don't see any members of the public on. We want to do a final vote, if possible, on the wildlife regulation that we discussed in June. And then Aday has a number of updates around the rodent contract, the MBTA. We need to do a Board of Health reorganization vote, and we'll kind of explain that when we get there. And then the usual reports and wrap up. Is there anything not on the agenda that we need to bring up at some point? Any other than
Not really. The only thing I would like to point out is that the board already voted on the feeding of wildlife regulation, so it's not a vote.
Oh, okay.
It's just more of to inform the board.
Yep. Okay, we voted on that in June.
Correct.
Was that a final vote? Okay.
Yes.
I didn't realize it was. All right. In terms of the minutes from June, are there any edits, comments, changes?
I didn't see any.
Okay. Okay. Great. So I make a motion to approve the minutes from June 13th. Do I have a second?
Second.
Second, Sal. Roll call, Sal,
Yes.
Kevin,
Yes.
Joan,
Yes.
and Rick, yes. So those minutes are approved. In terms of public comment, I don't see any members of the public present, so we're going to move on. Ade, you want to talk about the feeding the wildlife?
Absolutely. So
my
at the,
dad's really in my ear.
Excuse me?
I don't know where that came from.
I don't know where that came from either. Okay. There's no member of the public that I see, so
Hopefully nobody's sneaking any in.
yeah.
yeah, that was what happened the last time.
Yeah.
That was how we started.
Hmm.
Yeah.
Okay. Why don't you go ahead, Ade?
Okay, so at the June Board of Health meeting, the board moved to approve the feeding of wildlife regulation with a revision to section 26.3C, reducing the response time to remove or contain an attractant from 7 days to 2 days after a notice of violation has been issued. The board also requested I, review it with town council, and I did. She revealed that the board's amendment to this section is reasonable as long as there is a valid explanation for wanting to shorten the response time. At this point, everything looks good, and I believe the next steps will be to publish a summary in the local newspaper and send a final copy to the town clerk for publishing on the town website.
Okay, Ade, there were just 2 typos on the document you sent. I just, before you publish it, one minor one on section 26.2. In terms of attractants, you say actually, I take it back. I'm looking at it now. I thought there was an extra comment, and then take that back. And then the other one was in 26.41E. That the cause of the public safety threat or nuisance, the bird feeder, and I believe it was seed debris. Not
Yes, we were supposed to change that from the last
Okay.
time.
Other than that, looks good.
I actually said, I may have been what you were talking about, Rick. In 26.2, it was raccoon was misspelled. It's spelled with 1 C and it should be 2 C's.
Oh, okay.
Very minor.
Under what? Under wildlife.
Right, under, yeah, I didn't note that down. Just 26.2.
Okay.
All right.
I also had another question under 26.6. I just wrote down that it says regulations are constructed. And I wondered if it was supposed to be construed. Of course, now I don't have the document in front of me, so I can't read off the line.
Regulation shall be. Yes, it is construed. That's right. 26.6 under severability. . You have that a day?
Yes, we'll make those changes.
Okay. Terrific. All right. The rodent contract?
Yes, so I'm just going to give a brief background regarding rodent control. We started at the beginning of the year with 15 smart boxes using the remainder of the ARPA funding in the amount of $21,000. An additional $35,000 in funding was approved at April town meeting. With the additional funding, we were able to procure 35 additional smart boxes. So we signed a new contract on the 30th, and we now have 50 smart boxes around town with a total of 294 catches since we implemented this program at the beginning of the year. So things are looking good. This number is expected to rise through the warmer months and then decrease as we go through the winter months.
Were the new boxes, were some of them situated in the Pineville area where we've had issues?
Yes, absolutely. And then we also looked at the DPW construction map and schedules, and some of those boxes will be moved as constructions continue.
Perfect.
How are the reports going down a day?
Sorry, say that again.
Are the reports going down?
Well, we haven't received as many complaints as we would for this time of the year, so I'm very happy about that.
I know we had one resident that was really upset. She came on a couple of times. Just wondering if her problem went down at all.
It did. We deployed a couple of smart boxes over there, and we haven't heard from her since then.
Great, that's awesome.
Good.
Nice thing about those smart boxes is, with the poisons or even the contraceptive approach, you have to assume that there's some activity, but you can't actually get a specific count of the rodent. And with these boxes, you can actually get a number of catches. So that's great. Not to mention that it's safer for the environment.
Yeah, you get data. Data is good.
Data is good.
Absolutely.
Yeah.
All right. Should I proceed to the MBTA update? Okay. So the assistant town manager, Jane Wellman, and the Reading delegation had a preliminary meeting with the MBTA at the beginning of the month. Jane's understanding is that the MBTA will be meeting with the police chief and the fire chief, and then plan to hold public engagement sessions in early September. These sessions will include a remote session as well as an in-person session for residents who do not want to attend remotely. After public engagement process, the MBTA will come back to the select board with a more narrowed focus and answer questions the select board may have. Once that's all set, the MBTA will file a notice of intent with the Conservation Commission. From my understanding, the Reading delegation is actively engaging with MBTA to get as much information as possible. The delegation is also encouraging the MBTA to have as many meetings as possible with the residents. That's all I have for now, and I'll update the board in the future.
Okay.
Great. And we had a lot of discussion around the sound study, and hopefully we'll get more information over the coming weeks around that and how they're doing that. Okay, in terms of, if there are no other comments, in terms of we're flying through this, Adi, this is not the usual. we might be done by the time you have to leave at this rate, but this is not as usually this short. But in any case, reorganization. So the town bylaws require boards and commissions to every year, sometime in the June to August timeframe, to reorganize, meaning vote for chair, vice chair, and any other offices that are necessary. So it's an annual kind of process. And so the way we've conducted this in the past has been to have anyone nominate anyone, and people can nominate themselves, and we can take a vote on that. And so the two offices that we've traditionally done here have been the chair and vice chair. Currently, Carrie Donnell is the vice chair, but I'm not sure why she's not here. Ade, you didn't hear anything that she wasn't able to make the meeting.
I don't believe so.
Okay. So in any case, with that in mind, we'll start with the chair position. Are there any nominations for the chair?
I like the way Rick runs meetings. I'll nominate him.
Oh, thank you.
Second.
Okay, we have a second. Any other nominations? Roll call. I'll vote. Sal,
Yes.
Kevin,
Yes.
Joan,
Yes.
and Rick, yes. Thank you for your confidence in me, and we'll try to keep things moving along.
Thank you for your time.
Yeah, it's been
a lot
great.
behind the scenes.
It's been
Yeah.
really great. Thanks, Rick.
Yeah, well, it's been a very good experience for me, and I've learned a lot. And they don't teach a lot of public health in medical school. So this is
Yeah.
the end of my career. I'm learning a lot about public health. And in terms of the vice chair position, do we have a nomination or nominations?
Should we do that next week?
Next at our next meeting?
Well, no, excuse me, at our next meeting when Kerry's here. Because I'd hate to nominate Kerry unless somebody else wants to nominate themselves, but I also want to make sure she has an opportunity to nominate
That's a good point.
herself.
Yeah.
You know what I mean?
Yep, that's a good point. If
We only need a chair reorganization technically. So
Right.
the vice chair is something we could do at a different time.
I would wait. I'd vote for waiting.
I agree.
Sounds good. We can wait on that. Okay, in terms of monthly reports,
Yes, so we'll go ahead and present, and then Liv would present the nursing updates after. Okay. All right, so for the month of June, our health inspector, Amelia, conducted 14 food inspections, 3 camp inspections, 3 pool inspections, 4 food complaint investigations, 8 nuisance complaint investigations, 1 housing complaint investigation, and issued 1 temporary food permit. For the month of July, she conducted 15 food inspections, 4 pool inspections, 4 nuisance complaint investigations, 1 housing complaint investigation, and 1 foodborne illness investigation. All of the 18 keeping of animals permit have been renewed. And then I would like to give a quick update regarding the MEPHC. Annette no longer works for the Middlesex Essex Public Health Collaborative. This means the shared services coordinator position is now vacant. We're in the process of conducting interviews for prospective candidates. And I would also like to share a few items that I would like to propose to be on the agenda for the September meeting. I will include the dumpster regulation for a final board vote. I'll go over the newly created haulers regulation, and then I'll give an update on the fee schedule increase. And that's what I have for now. Liv, please go ahead with the
Can I,
next
can I
update.
just ask one question, Ade,
Yes.
before we leave? At the June meeting, we delegated to you, we gave a permit for the YMCA summer camp.
Correct.
And before the inspection was done,
Yes.
was the inspection done and was that satisfactory?
Yes, it was done. Everything is satisfactory.
Okay, great.
Thank you.
Go ahead, Liv.
Okay, I'm just going to go ahead and share my screen. All right. All right. Thank you, everyone. Happy August. I can't believe it's the end already of the summer, but here we are. All right. So here is our disease report for last month, the month of July. We had a calm month for the flu, under 5 cases, which was great. COVID, we had 16 cases last month. This new variant is called Stratus, and it's now the 3rd most common COVID strain. So if you have symptoms, consider getting tested. Lyme disease is starting to pick up in town. Please always remember to check yourself for ticks after any time spent outside. Also, make sure you're checking your pets and your kids for ticks. We have tick removal kits courtesy of MEPHC, the Middlesex Essex Public Health Collaborative, over at Town Hall. So if you'd like to pick one up, they are right at the clerk's desk. All right, these are my blood pressure screenings for the month of August and September. Next week, next Monday, I'm adding a 3rd location at the library. So I'll be on the 3rd Mondays of every month. I will be at the Reading Public Library at 2:30 p.m. So that'll be this upcoming Monday, the 18th. And then next Thursday, I'll be at Frank Tanner at 10 a.m. And then in September, I'll be at Pleasant Street Center on September 4th, the library on September 15th, and Tannerville on September 18th. Just some awareness month topics for this month. It's August, which is National Breastfeeding Awareness Month, promoting the health benefits of breastfeeding for both babies and mothers and the importance of support for breastfeeding families. It's also Children's Eye Health and Safety Month, reminding you to protect your eyes as from the sun as well as during play. We have 3 vaccine clinics coming this fall to the town. They will be held at the Coolidge Middle School, so it's 89 Birch Meadow Drive. We're going to have them on September 26th, October 17th, and November 7th from 2 to 5 p.m. That code will get you there as well as the link below. I also have this posted, this will be posted on the town Facebook page as well. All right, and just as a reminder, I still have my take back programs going on. They are very popular right now, but if you have any supplies, we have some awesome places that will take everything. And that is all. Thank you so much.
Great, thank you.
Thank you, Liv.
Well, I should mention that we still have free COVID testing kits at Town Hall.
Okay.
And people are welcome to come by and take 1 or 2 as needed. The other thing I just mentioned, I've talked to Ade about it, I'm sure Liv also knows about this, is that a lot of the work that is being done that you just saw fits in nicely with our community health improvement plan. And I'm hoping that over the next couple months at a meeting, Liv can come and really structure the clinical program report as it relates to our goals and objectives for our community health improvement plan. So we can see where activities are being done that are meeting our goals around this, and where there's areas where we need to focus more on. So I'm looking forward to that at some point over the next 2 or 3 months.
Absolutely. Thank you.
Any other comments, questions, discussion?
It'll be a record.
I know, right?
This is a record. Definitely.
Addie's a good luck charm.
Seriously,
Yes.
Addie.
I don't know. I do meetings for work, guys, so hopefully I don't bring the bad juju here.
I don't think we've ever done one under 30 minutes. That's crazy.
That is incredible.
So I just got a message from Carrie, and she's about to join.
Oh.
You may want to let her know that we're
We're done.
about to adjourn.
Well, we might have time to nominate her as vice chair.
We could.
That's-
Okay, so all right.
It was nice meeting you guys. Take care.
Nice meeting you, Day.
Very nice.
meeting you.
Addie.
Oh, she's here.
Okay.
Hello. I am so sorry. I'm so sorry. Here I am. Yeah,
Nope, you made it.
Yeah,
I
you
made it. I thank you all. Looked at you all sitting there patiently. Oh, hi. What do you need me to do to keep us going?
Well, actually,
Or not.
We're all done.
We're done. We've gone
Oh.
through the agenda. However, we were going to delay, we have to do our annual reorganization, and we were going to delay nominations for vice chair
Mhm.
until next month when you could join us. But now that you've joined us,
Yeah.
you can make those nominations. So do I have a nomination for vice chair?
So the question I would
Yeah.
ask is, Kerry, are you interested in
Yes, sir.
retaining vice chair? Because I would nominate Kerry for vice chair if she is interested in continuing that.
I am. I don't want to, if anyone else is interested in assuming that role, I would not want to stand in their way.
I second.
Oh, okay.
So I have a nomination from Kevin, second by Sal. Roll call, Sal,
Yes.
Carrie,
Yes.
Kevin,
Yes.
Joan,
Yes.
and Rick, yes. Great, congratulations, Carrie.
Very much. Thank you. I appreciate your, thank you. I really enjoy this board. I like serving with y'all and I appreciate the opportunity. So thank you.
Great, thank
Great
you.
contributions. Thank you.
Okay.
And with that, I'll make a motion to adjourn. Do we have a second?
Second.
Second, Joan. We'll take a roll call vote. Sal,
Yes.
Carrie,
Yes.
Kevin,
Yes.
Joan,
Yes.
and Rick, yes. Thank you all, and we will see you in September as the song goes.
All right.
You in
Alright.
September. Hello.
Enjoy the rest of your summer.
Good
Bye,
night.
everybody.
Take care.
Bye-bye.
Bye-bye.